Welcome to Insightful Psychiatric Mental Health. Today I wanted to discuss something that often causes folks to not get the help that they need for their mental health, and that's called stigma. Mental health stigma is still very much present even in today's day and age. Mental health stigma refers to the behaviors, the attitudes, and the beliefs that people have towards those with mental illness. It's a widespread, it's a major societal issue. It's found in many cultural groups and ethnic backgrounds, and unfortunately, it has significant consequences towards those with mental illness. There's some different kinds of stigma, and I wanted to review that as well. So, one is called public stigma, and that's basically the public view of mental health being negative, negative thoughts about those that have mental illness. So you might hear phrases like, people bring their own problems upon themselves, or those with mental illness are incompetent. There's also self stigma, so negative beliefs towards oneself. Um, and that's basically feeling negatively about oneself if they do struggle with their mental health, like I'm worthless or I'm hopeless or I can't do anything. There's also institutional stigma, and we find that policies and practices within institutions such as healthcare or workplaces that discriminate against people with mental illness. So, folks with mental illness might fear that they're not going to be able to find a job because they have a mental health condition. There are consequences of stigma, and those consequences include, reduced treatment seeking. So the fear of being judged or discriminated against can prevent individuals from seeking the help that they need. There's also poor treatment adherence. So the stigma can be difficult for individuals to deal with, and it might make it hard for them to, follow treatment plans and take medications regularly. There's also a component of social isolation. So again, with the fear of what others might think of the individual with a mental health issue, people might just avoid social contact or social interactions because they don't want to be judged by others. Discrimination is very much real. And people with mental illness may face discrimination, again, in workplaces, education, and other areas of life. There's also the increased risk of suicide. So stigma can contribute to feelings of hopelessness, despair, and suicidal ideation. How do we combat stigma? Well, the first step is to educate yourself and then educate others. Let's have an open dialogue. Let's bring this up in conversation. Oftentimes we'll hear people talking about the new fad diet that they're on, or their new workout routine, or what they're doing to, bring down their blood pressure. But why can't we talk about mental health the same way? I mean, if we have a brain, which we think most of us do, um, we're all going to be vulnerable to mental illness. The brain is another organ in our body, so why can't we treat it like any other aspect of our health? We have to challenge negative attitudes toward mental illness. We have to speak up against any discriminatory language that we hear and behaviors that we see. We have to promote understanding. Share personal stories with each other. There's so many of us that have struggled with our mental health at some point in our life or know someone that has. Let's talk about these experiences. Support individuals with mental illness. Well, offer empathy, offer a listening ear, support, encouragement, and advocate for policies whenever you get the chance. I did want to bring up one other aspect here around stigma and mental illness. There are certain cultural groups or ethnic groups that still find it taboo to discuss mental illness. We have to break that cycle. Again, we have to be open-minded. We have to educate ourselves, educate our children, our parents, our grandparents, our friends, and start normalizing mental health. We just have to do it. There's so many people out there that just out of fear of what others are going to think or how they're going to be perceived, they just don't get the care that they need. We don't need to lose people to mental illness. We don't have to wait until rock bottom. We have to be proactive. And that's the message that I want to send out today. Mental illness is just as important as any other aspect of our physical health.